Hey, welcome to Real Talk Town Hall. My name is Sharonda Everett with United Way of Delaware's Community Engagement, and I'm accompanied tonight by my amazing colleague and co-host, Wanda Barrett. And we're honored to moderate tonight's panel discussion. I want to thank you for joining us tonight for this important discussion on COVID-19. I also want to thank the Wilmington COVID-19 Community Mobilization Group and a special thank you to our esteemed panel of experts joining us tonight to help answer all of our questions. We know there's a lot of information floating around about the virus, vaccinations, and changes in the guidelines. So we brought together these panel of experts to help us sort through all of the information, what's true and what's not. Tonight, you'll be able to get your questions answered. And so if you have any questions throughout this session, you're able to put those in the chat and we will do our best to make sure we answer all the questions. And so I do want to introduce and pass it over to my co-host, Wanda Barrett.
Hola, Sharonda. Gracias por la oportunidad. Mi nombre es Wanda Barrett. Soy gerente de Latino Community Engagement para United Way. Primeramente, quiero darle las gracias a todos que hicieron que este evento fuera efectivo y bien exitoso. Vamos a empezar por el Departamento de Salud Pública, el First State, todos los que están al frente de esta batalla, que son Kent County, Sussex County and Newcastle County Coalitions. Tenemos también el DRJC y hay United Way, claro está, con la bandera siempre al frente. Esta noche traemos un panel de doctores fenomenales que nos van a ayudar a esclarecer nuestras dudas y mala información que está corriendo por la comunidad. Tendrán preguntas y contestaciones con información contundente y precisa, ¿verdad? Para que tenga claridad. Yo voy a ser la persona que voy a traducir y voy a en el panel 5 doctoras fenomenales y una de ellas habla español, ¿verdad? Aquí vamos a tratar de hacer todo lo posible. Thank you, Sharonda. Take over.
Thank you. So we'll just go over the flow for the evening. What we were able to do, we were able to fill a lot of questions that we really want to put to the panels, to our panelists. And so we'll ask questions and each panelist will have about a minute to answer the question. And again, we'll be checking the chat for any questions from the audience. And so I would love, and I'm excited to introduce our panel of experts. Tonight we will have Dr. Coker. We will also have Dr. Scantlebury and Dr. Mpasi, Dr. Rattay, and Dr. Angela will all be joining us tonight to answer any of the questions you have regarding vaccinations, symptoms, the guidelines, really all things COVID-19. And before we begin, we do have a testimony we'd love to show you.
Hello, my name is Norman Hutchins. I am a Grammy Award gospel recording artist. One of the questions that many people are asking is why get vaccinated when those who are vaccinated, many of them still contract the virus? Well, let me tell you my story. I just got out of the hospital 3.5 months because of the complications of COVID. But I'm alive today because I was vaccinated. Many people were dying around me almost every other day, but it was because they were not vaccinated. You see, just because you're vaccinated doesn't mean that you will never contract the virus. But what it does mean is that if you contract the virus, It will help you in a critical time. And so I'm encouraging all of you who have not been vaccinated to get vaccinated. Listen, it is better to have it and not need it than to need it and not have it. Please go get vaccinated.
Thank you for that.
Mm.
That was really impactful. And you know, we regular folks, we don't know everything. We don't know what's going on. And I know I have lots of questions. And so I know you have lots of questions. And I'm so grateful tonight to be able to bring these experts together so that we can get those questions answered. And that way we can move forward and make decisions that are best for our health in the community. So how we'll answer the questions. We have our panel of experts. They'll have about a minute to answer each question, and we'll just move through and we'll be checking the chat for any questions that you have. Do we have okay, great. So as you answer the question, before you do, if you could just give us a little background about your area of expertise as we go through each question. And so my first question is for Dr. Scantlebury. What is the science behind the development of variants from the virus? So there was the Delta variant and the Omicron, and what's the difference in severity, the transmissibility, the treatment, and why is the isolation changed from 5 days with these different variants from the original 10 days?
Well, good evening, everyone. Thank you, Sharonda and Wanda, for being our moderators for this wonderful session on Real Talk COVID. And I wanted to, first, I'm Dr. Scantlebury. I'm a retired transplant surgeon, and I have been involved in the efforts to get more people vaccinated and also receiving the boosters, especially we really need to increase the number of people who are protected from this SARS-CoV virus. And so part of my background is also as a transplant surgeon is immunology. And so understanding the science behind how variants occur, we have to remember that SARS-CoV-2 is a virus. And like any other viruses, they will occur, they will change over time. They will go through what we call as a mutation, and new variants of a virus are expected to occur. And so what happens is that as the virus replicates in our bodies, it begins to change somewhat from one person to another. So the more people that are infected in the community, the more infections happen, the more opportunity that this virus have to mutate or become a slightly different than what it was before. And some of those changes can occur in the spike protein or various areas of the virus itself. To say that the spike protein may change somewhat. Let's think of the spike protein as a red rose. And so as the mutations happen, that rose may become a little bit different. It may lose some petals, and so therefore it's not the same anymore. Or it may begin to look a little bit more like a petunia flower as opposed to a rose. And so as the virus becomes or changed to become a little bit different from the other virus, then these mutations are able to evade the antibodies that your body produced, either by having been vaccinated. And the more, every time you get vaccinated and your second dose and your booster, it allows your body to make these antibodies, and they're like your policemen. And those antibodies are there to help attack and destroy the virus as it comes along. So the more antibodies you have, the more you're able to fight off that virus. But the more that virus change, the more those new mutants can sort of slide by your antibodies, and the antibodies may weaken or make your immune system not as effective. And so you go from one variant to another, because as we have more people and more hundreds and thousands of people who are infected, first you have the Delta virus. That's just one, we go down the Greek alphabet, and we have the alpha and beta, and now we're Delta, and we're all the way down to Omicron. And so some viruses are much more dangerous than others. Delta versus Omicron. Omicron now is much more, it spreads about 3 to 4 times faster than Delta variant. So it's a bit stronger. It is more, it has the ability to get into the body and it spreads easier. Therefore, more people are getting it. The disease severity may be different from one to another because some people may have more antibodies and therefore the Delta might have been more severe. You find that maybe the Omicron is spreading faster, but patients are not as sick because we have many more people who have antibodies. And so that's sort of the science behind it, is that the virus, as it becomes different from one variant to another, it has more ability to evade our immune system, even if we have those antibodies. So vaccination is important because it helps us evade that, and it does offer protection. We're all going to get the Omicron variant at one time. We're all going to get SARS at one point or another. Having those antibodies is going to keep us out of the hospital. It's going to keep us from dying. And I hope that was a decent explanation.
Yes, thank you for that. Thank you.
Yes, thank you. Very interesting information, right? Can you see me, Sharonda?
I see you.
I'm over here in the other studio. So, doctora Saldarriaga, aquí tenemos una pregunta para usted. ¿Son efectivas las vacunas contra las variantes? Si son efectivas, ¿lo podrías explicar de qué manera y el por qué del refuerzo? Doctora Saldarriaga.
You need to unmute.
You're still on mute. There you go.
Can you hear me?
Yeah.
Yes.
Okay. So I just want to say en español, quiero decir gracias por invitarme a esta sección. Definitivamente con el tiempo el virus ha ido cambiando, aparece esta nueva variante. Las vacunas que tenemos sí son efectivas, pero se ha notado y se ha investigado que la protección ha bajado bastante. Por eso se ha incrementado en la población lo que llaman el booster. Lo que queremos hacer es tratar de mejorar ese sistema inmune otra vez para que realmente las vacunas incrementen esa policía, eso que nos defiende contra el virus, que se llaman los anticuerpos. Entonces, sí, la respuesta es que se ha encontrado que las defensas bajan, que necesitamos el booster y por eso nos necesitamos seguir vacunando.
Muchas gracias, doctora Saldarriaga. Sharonda.
Thank you. Thank you for that.
Mm-hmm.
And this next question is for Dr. Coker. And this question, it's come up a lot. It's like a real source of frustration and confusion. Why are there so many changes and inconsistencies in the information being shared with the public? When to get tested, when to isolate, how long to isolate, when to quarantine, when you're infectious, when you're not. It's gotten really confusing for people. Why does it keep changing?
That's a great question, Sharonda, and I'm so glad that is top of mind for everybody, because that is the frustration that we all feel as well. So let's just talk about the last 7 days. So for the last 7 days in America, we have had 800,000 cases of COVID per day, 800,000. We have had 21,000 folks going into the hospital in the past 7 days. Now that's a higher rate than any other time in this pandemic. So the $10 million question is, here we are nearly 2 years later, and we are possibly at ground zero with hospitalizations and infectivity. So why is that? That is because the only thing that we can be certain of is that there will be uncertainty. So if we could control one part of this pandemic, such as the vaccination piece, we might be able to give you real-time answers real quickly. but we can't because everyone is all over the board. So we're putting a plane together in flight. So you've got scientists collecting data, monitoring data, and trying to come up with best practice when each day, if we would just get a little closer to immunity among the public, then we might be able to say, listen, because everyone's vaccinated, if you get exposed, but you're asymptomatic, go to work, go to school, no big deal. But we can't do that because this one's vaccinated, but that one isn't. Grandma is, but the teenagers aren't. Mom is, but dad isn't. So while everyone is frustrated with the CDC and some of the other entities, the frustration is with us because we are not taking care of one another. So are they doing the best they can with the data that they have? Absolutely. Does it change on the fly? 100%. Just imagine if we didn't have the vaccines as we do now with this amount of infectivity. We would be looking at freezers filled with bodies in New York. Again, the Delta variant was taking out 4,000 folks in India a day. Then it came here in no time flat. Omicron is 8 times as contagious as the original SARS COVID virus, 8 times. So you sneeze and you have it, and you'll probably infect about 7 people. So what I want everybody to do is just settle down. We're trying to moderate the data. We're trying to analyze the data and come up with best practice. But if everybody would just get on the right page, which is let me put a weapon in the toolbox so that I can decrease the contagious rate, so I can decrease infectivity, so I can look out for that cancer patient. Can I look out for grandma, my 2-year-old who didn't make the list yet? If we could get there, all of this frustration that everybody's feeling would get better. But because nothing is controlled, vaccines, boosters, I'm vaccinated. I don't even believe that there is the COVID virus, say some. So when you've got that kind of population and you're trying to get a handle, it's like herding cats, Sharonda. So are they doing the best they can with the information that they have? 100% they are, but we are literally putting a plane together in flight and there is no control on either side. And that's the problem.
Wow.
Thank you for that explanation, because that was a question that I had. So that really helped help it make sense for me, and I'm sure all the folks watching.
Amazing, Sharonda. Amazing information, precise and stout, right? True reality. I'm going to ask doctora Ángela, vamos a hacerle la misma pregunta a usted en español. ¿Por qué hay tantos cambios e inconsistencia en la información que se comparte con el público?
Primero, yo pienso que es mucha información y realmente para poderla hay que estudiarla y hay que basarse y buscarla de entidades que son realmente científicas y saben del tema. Entonces, primero, estamos recibiendo información de todos los frentes, la prensa, el radio, el internet, el Instagram, las asociaciones científicas. Y de pronto es difícil realmente para la gente que está por fuera del campo médico, que no tiene muchas bases de conocimiento científico, analizar y decidir qué es lo que realmente es verdad o no. Entonces, es demasiada información. Los cambios realmente han sido rápidos, porque la información que se publica se da es por lo que ve la comunidad científica del día a día, y las cosas cambian. Y no podemos esperar que lo que estaba correcto hace un mes y medio, que decíamos que eran los 10 días y ahora estamos diciendo 5 días, persista. Si hay nueva información, nuevos datos, entonces eso es lo nuevo. Entonces la gente tiene que entender que a medida que recibamos más información que se ha comprobado científicamente, las cosas van a cambiar. Entonces no nos podemos quedar en el pasado tenemos que ver cuál es la información actual presente desde el punto de vista científico y de ahí tomar decisiones.
Gracias, doctora Sharonda.
Thank you. And so this one's for Dr. Rattay. And it's like a 4-part question. What should I do if I test positive and I have symptoms? What should I do if I test positive but I don't have symptoms? And if I just recovered from COVID, when can I get vaccinated? And lastly, if I test positive for COVID, what's the likelihood that I'll get COVID again?
Okay, great. First of all, it's really a pleasure to be here and such a privilege to be sharing this stage tonight with such esteemed, incredible women physicians in our state. Thank you, United Way, for hosting this. So these are great questions. And as Dr. Coker said, lots of people are getting infected right now. So we are seeing a lot of people who are positive, some with symptoms, some without symptoms. And Omicron has changed a little, certainly compared to the beginning. So even just your basic cold symptoms or a sore throat are the most common ways that we're seeing Omicron presenting. So before, people may have brushed it away, thinking, it's just a cold, but we want people to pay attention to any symptoms right now and ask if it might be COVID. So if you test positive and you have symptoms, it's very important that you isolate from other individuals for at least 5 days. And that means, in your home, trying to stay away from everyone else, wearing a mask if you're in a common area with others, but certainly, not going out into the public to infect other individuals. So once you get a positive test, you look at the day you started with symptoms, you count 5 days forward from that. If you develop a fever, you need to make sure that your fever is gone for at least 24 hours before you can get out of the 5 days. So let's say you develop a fever on day 5, you really can't get out of quarantine, or I'm sorry, you shouldn't get out of isolation until you're fever free for at least 24 hours. And if you have no symptoms at all, which is great, but you still are contagious. You can still transmit the infection. And a lot of people are like, I feel fine. I'm not going to get anyone else sick. Well, we're seeing a lot of spread from people who don't have symptoms. So you still have to stay in isolation for 5 days, but this time from the time you have a positive test. And then if you have no symptoms and you're doing fine, you can go out in public again. But very important, whether you have symptoms or not, it's extremely important that you wear a mask for those following 5 days, because although you're going to be much less contagious, you still may be contagious. And so wearing a well-fitted mask for those final 5 days, so a total of 10 days, is really important. We want to make sure nobody forgets that step. So once you hit the 10 days after you either develop symptoms or were tested positive, you can go back resuming normal activities. And at that point, you can get vaccinated. So it's absolutely fine to get vaccinated at that time. And thank you for the questions, Sharonda. If I missed it, the 4th part, I apologize.
Thank you. The 4th one was, if people test positive and they get COVID, what is the likelihood from what you're seeing in the data that they're going to become positive again?
Yeah, that really is a great question. And so natural immunity, for one thing, it's not clear how long it lasts. We know that natural immunity from the infection does provide some immune protection, but what we're seeing with Omicron and the studies from South Africa is that natural immunity is not very protective against getting Omicron. Now, having the vaccine, the natural immunity plus the vaccine is pretty strong immunity, but still it's not a guarantee. So, at this point in time, if you have had COVID, consider yourself vulnerable if you have not gotten a vaccine, and please get the vaccine so you can really boost your immunity.
Thank you for that.
That's amazing information, huh? I want to go to the chat room for a minute, Sharonda, because I saw some questions popping up. There's one here that says, I just had COVID. What is the probability I can get it again if I am exposed? Dr. Coker, you might want to answer this question for our panel, our audience.
Yeah, I mean, just as Dr. Rattay just mentioned, unfortunately, natural immunity just seems to fade. Usually you may get about 30 days, but with Omicron is a bad little actor here. I mean, this little dude is changing up those little rose petals, as Dr. Scantlebury mentioned, and he's slipping by even those of us that are vaccinated and boosted. You may not be terribly sick, meaning requiring hospitalization, but a lot of folks that are vaccinated and boosted really are out of gas with Omicron. Very, very fatigued, sore throat, cough, all of the symptoms. So can you get it again? Unfortunately, yes, with or without the vaccine. But please understand, those of you that are not vaccinated, therefore not boosted, the second one may require hospitalization and possibly even intubation, meaning a breathing tube. You're on a machine and we're breathing for you. So the best weapon, and as Dr. Rattay mentioned, shortly after you are asymptomatic and feeling better, please consider getting vaccinated. And if you have been vaccinated and it's time for your booster, by all means, get that booster shot, because it seems to be holding up pretty well with the Omicron. Thanks for the question.
Thank you, Dr. Coker. I'm going to shift now to Dr. Angela and ask her a question from the Hispanic community. Dice aquí, doctora Ángela, ¿cómo deberíamos de deshacernos de las máscaras de tela? ¿Cuál tipo de mascarilla sería eficaz y eficiente para que podamos conseguir, y cómo conseguirlas, si es posible que usted sepa esa información?
Realmente la demanda ha sido tan alta, el suplemento ahora ha mejorado bastante. O sea, las máscaras realmente tenemos mucho más fácil acceso estos días en las farmacias o en diferentes almacenes. Lo más importante es, como hemos dicho, que la máscara debe ser fitted, que debe estar por encima de la nariz, que debe cubrir y sellar todo el área de la boca, para que no se salgan las partículas del virus. Ahora, la prueba de la máscara debe ser sellada, que no pasen esas partículas. La gente dice que se puede poner siquiera 2 máscaras, una detrás de otra, de las regulares. Ahora el personal de salud usamos máscaras más fuertes, más fitted, dijéramos, más eficientes. Realmente, ¿cómo te pones la máscara? ¿Cierto? Cómo la usas, el material de la máscara y dijéramos las 1,95, que son las más fuertes, las que usamos el personal de salud.
Gracias, doctora Ángela. Sharonda.
So I'm going to take a question from also from the Q&A, and Dr. Scantlebury, if you'll answer this question. Is it possible that we will need another booster in upcoming months?
That is an excellent question. What we're finding is that for those of us who are fully vaccinated and boosted, we are able to better fight off the virus. But we know that over time, we're losing some of that antibodies. And currently, we're maybe not 95%, I think only about 70%. And we know that by the time you get to about 5 months after your booster or your dose, you are losing about 30% of your antibodies. So one of the things about what's moving forward is that if we still have so many people that are unvaccinated and unboosted, and the virus continues to mutate and go from person to person, we will eventually see another variant and we will have more risk of infection. So as we lose immunity, those level of antibodies after getting that booster, by 4 months, more than likely we will need some kind of booster to bring us back up by about 6 months. So yeah, I think even when we look at those who are immunocompromised, transplant patients and others who may be at risk, cancer patients, they're not able to hold on to those antibodies. So they may be the first group of people who will be considered for that fourth dose.
Thank you for that. I have a question about masks. And Dr. Rattay, I wonder if you can answer this one for me. It's about the cloth mask. Do we need to throw out all the cloth masks and just purchase disposable masks? And if we're purchasing those disposable ones, which ones are the best as far as the medical versus the N95s?
Yeah, it's a really great question. And there has been a lot of attention around mask wearing recently. The science is clear. Masks make a huge difference in decreasing the spread of this respiratory infection. So most important is wearing a mask. Having a mask that you will wear is important. We see people go out and buy N95 masks, but they're not comfortable. They may not fit around their face well. So then they wear it around their chin, and that does no good at all. Cloth masks actually can be effective, but they need to have multiple layers. They have to have a well fit around the nose and the mouth, so you want no gaps. Now, if you're going to a place like a healthcare facility or a long-term care facility or a crowded congregate setting, then you really do want to use a higher level mask. Or if you're immunocompromised, you also, you can get more protective masks to ensure that you're protected and you're not spreading to anyone else. I really like the KN95 masks. We all have personal preference. That one is, it's not very expensive. It's very comfortable and it really fits nicely. So you can wear it for many hours and not, it just, for me personally, I run in it and it doesn't bother me. But you want to make sure that they're not counterfeit. So there's a lot of good information out there on the internet about, what are the best masks to get right now. Most important is getting a mask, using a mask that you really will wear, and especially when you're around other people, vulnerable people the most.
Thank you for that.
Very good information, right, about masks. We've been getting a lot of questions regarding masks and if they want to throw out their mask or anything. We're going to shift gears here a little bit because we're going to go to the segment where it really hits home, is our children. Right, Sharonda, we're going to shift gears to Dr. Mpasi, our pediatrician in the house, and also an expert on these efforts against COVID, right? I believe you have the questions for her. Thank you for being with us, Dr. Mpasi.
Dr. Mpasi, this question is obviously for you. Why are there so many children becoming infected? There's like a surge and increase in kids being infected with COVID.
Yeah, this is a great question. And again, I want to thank United Way and Sharonda for the work that you've done and being a part of this esteemed panel. So again, I am a pediatrician. I am pediatrician and public health manager at Henrietta Johnson. We're located in Newcastle. And so a lot of my work, I see patients from day one of birth up to 22 years old. And I'm great. I'm thankful that our practice is also doing a lot of COVID activities. We're vaccinating and we're testing regularly. And I am seeing children. We are seeing a rise in children with positive tests. So let's think about the setting for our children, right? Where do they spend the majority of their day? About 8 hours a day in a daycare setting or a school setting. So they're around other children. And I'm going to start off by saying that that's actually really important. I definitely want to applaud, the Division of Public Health. I want to applaud our governor, right, and our school districts for really collaborating to ensure that we could get kids into school safely. That's important, right? Their education is important. Having mask mandates, offering vaccines at the school-based wellness centers, ensuring that there's testing access. Our kids need to be in school, right? Our kids need to go to daycare so that our caregivers can work. So that I think is first and foremost. And we are trying to do that safely with our kids, ensuring that they're wearing their mask every day. And of course, number one, ensuring that they're getting vaccinated if they're 5 years or older. Now let's think about children, right? So how many of you are caregivers out there, whether your mom, whether your aunt, grandmother, et cetera, and you will have to sometimes remind children, not more than once, more than twice, right? Have a seat, do this, right? It's the same thing with the mask. Make sure you wear your mask. Make sure you cover your mask properly. Make sure you cover your nose, right? So children can be in the classroom, they're trying to learn, that mask might slip down, right? We have to remind them to put it up. They're around other kids their age, right? So they're in close quarters. I've actually been in a school system where I think the desks were well separated, but some of the kids are still sitting where they can at lunch if they're not in their classroom. So the kids are interacting with each other, and we know that they're in a little bit of close quarters. They may not have the opportunity to, work from home. So again, and I think Dr. Coker really addressed this as well, especially when we think about the Omicron variant. This variant is really transmissible, right? Once it's in the air, if you're in that area, you can catch that. So we're definitely seeing a lot more children getting infected. What's been great, or what I should say is reassuring, is that especially our children who are vaccinated, they're having very mild symptoms, right? So they're noticing that they may have a light headache, they may have a cough, they're isolating for the required amount of days, and they're recovering rather quickly, which is great. The other aspect that we have to be mindful of, and I know that I think this question is coming up, is that children that are also in the homes too, right? So they're going into a home where there's other family members, right? So we love big families, but when you have one person, two people, five people that are congregating, that increases your risk of exposure. So we have to be mindful of that as well. So that's why I tell people, limit where you have to go, should be work and home. Limit where you have to go, school and home, perhaps the grocery store is needed. But if you're in the home setting, right, and if you have a family member that might be at high risk, people can wear their mask in the house. You can wear your mask when you're in the house, when you're around people. But ultimately, the goal is to get everyone in the family vaccinated, right? That's how we're going to protect each other, right? So if grandma gets vaccinated, aunt gets vaccinated, mom gets vaccinated, dad gets vaccinated, big brother gets vaccinated, right? Because there might be a child who's under the age of 5 that cannot get vaccinated, yet you're still able to protect them, right? That's a way to protect them, is because you are going to decrease the likelihood of transmission, right? Or decrease the number of variants that they're exposed to. So that's really, really critical as well. So I am one that advocates, right, for children to be in settings where they need to be in school. And again, I'm going to applaud really our school districts that have worked to make sure that we're keeping masking. And then of course, all of our community partners that are offering those vaccines in that regard, so we can make sure that they're safe and healthy in their school settings.
Wow,
Thank
that's
you, Dr.
amazing,
Mpasi.
right?
That was great information.
Absolutely.
And
That's
staying with the babies and the children, we did have a question about breastfeeding.
Yes.
right.
What are the risks associated with breastfeeding and being positive for COVID?
Right. So there are always benefits to breastfeeding, right? We're going to change this word here. There's always a benefit to breastfeeding. So we know that COVID, right, it's respiratory, it's transmitted if it's in the air in that regard. It is not transmitted through breast milk, right? But what is transmitted through breast milk, right, is antibodies, right? So mother's antibodies are actually transmitted to baby. That's one of the reasons why we advocate for breastfeeding, which is awesome. So we encourage, right? So what's really great is the American Academy of Pediatrics, the American College of Obstetrics and Gynecology, right? Of course, we're focused on mom and baby, right? We are advocating there is safety in vaccines for women that are pregnant or expectant or trying to conceive, right? And so we encourage that vaccine early on. And then mom is building antibodies, right? So mom is being healthy, that ensures that baby's healthy. And then when baby's born and mom starts to breastfeed, all of her antibodies, her immunity, right? That's COVID, that's all the vaccine that she had, is being transmitted to baby. So baby now has that layer of protection. So there's always benefit in breastfeeding. We know our breastfed babies tend to gain weight a little bit more quickly. In pediatrics, and Dr. Rattay, fellow pediatrician herself, breast is best, right? In that sense, because of that added layer of natural immunity, but there's absolutely no risk at all to breastfeeding when it comes to COVID-19 or any illness. Now, there can be, of course, I always tell expectant mothers that are newly delivered, right? If you're taking a medication, that's very different, right? Obviously speaking with your OBGYN about that. But when it comes to taking a vaccine and passing along the antibodies, there's always a benefit in that. Great question for whoever asked. I really appreciate that question.
Thank you. Awesome answer.
Yes, well, very good information about, our children are our jewels, right? And we
Yes.
protect them more than what we protect ourselves, right? We need that
Yes.
information. Thank you so much, Dr. Mpasi. Doctora Ángela, tengo una pregunta aquí para usted, a ver si la puede contestar, porque en el campo de la ginecología, de las madres que están embarazadas y que van a lactar a sus bebés.
Claro, está muy bien, no hay ninguna contraindicación. Todas las mujeres embarazadas o como decía la doctora pediatra en inglés, las mamás que van a lactar, está no contraindication de la vacuna. Thumbs up de la vacuna, arriba la vacuna.
Gracias, doctora Ángela. Sharonda, it's all for you now.
Thank you. So Dr. Mpasi, just staying in line with just these questions about children, I think that it's just very confusing and people are very careful when it comes to their children. So they want to make sure they're doing the right thing. How do we build trust in the community to get more families to follow the guidance and get their children vaccinated and boosted? Like, how do we help assure that it's safe for the children?
Right. Another excellent question. And I will always share with families, with caregivers, that when you have questions, you should ask those questions, right? Do not keep those questions to yourself, because you want to be able to go to someone with whom you feel comfortable, someone you trust, someone in your community, right? And someone that has the best interest for your child and your family. So I would say start with your pediatrician. It's a great place to go if you have questions about your child. I actually get dedicated training on with all pediatricians, specifically on how to take care of children, and children are part of a family. So we learn how to take care of families as well, right? So I dedicate my, really my career to ensuring that our children are safe and healthy. So I certainly understand the questions and the concerns that parents have. And anyone that comes to see me at Henry Johnson, I know if you see any pediatrician, we actually sit and take the time. What questions do you have? How can we reassure you? How can we open that dialogue? So, one to start is, I applaud our parents, first, really from birth, right? We're starting to make sure that children are protected from what we call communicable diseases, right? So diseases that are passed in the community. If I name a few, if I could see you all, you would start nodding your head, right? Chicken pox, measles, right? Whooping cough, right? We know that these are diseases that tend to be out in the community. And what we know is that we start actually providing vaccinations to our children at a very early age, right? And many of you all do that, right? Child's going to daycare, they come and get their 1-year-old shots. The 1-year-old visit tends to be tough, right? Because it could be a lot of shots, but we know that they're now getting out in daycare in the community. We start that. So I think all of you as caregivers have already demonstrated what to do, right? To ensure that your child is safe. And I say that in that regard is because in that same way, right, where we offer the childhood vaccines that, from, 2 months and 4 months and 6 months and 1 year old and 2 years old and 4 years old, right? You are making sure, right, that your child is going to be protected, right, in that regard. And it's the same way then with COVID-19, this vaccine, again, it's very safe, it's very healthy. We talk a lot about, what is the greatest risk? I think that word used risk, and to me, it's the side effect, right? So I would rather a child have some side effects from a vaccine, which could be soreness at the arm site, right? It could be a headache, a light headache for a couple of days, right? And then have that immunity to protect them when they're out in the community versus the risk of not having any protection, no vaccine at all, coming into contact with COVID, catching that, right? And then developing some really moderate or severe symptoms, right? What I want to do is make sure that people are staying at home. We don't want to see them in the hospital. Dr. Coker alluded to that, was very passionate about where we are in terms of hospitalizations. We have seen kids in the hospital. I never want to see a child needing to be in the hospital. And we certainly know that kids that are getting the vaccine, right, are not in that regard. So that I think is the first and foremost. I think the second, way again to make sure that our children are being protected, right, is masking at all times. We know that masks are safe and effective. There are child-size surgical masks, so that is never an excuse, right, to say, well, I can't find a mask for my child. I'm telling you today, if you don't have a mask for your child, tell them to come see me, 601 Newcastle Avenue. I will give them a mask. This is a surgical youth fitting mask that has loops that you can adjust. So as Dr. Rattay said, it's got that nice bridge over the nose there. And then of course, what's really important is people that live in households, right? If you live in a multi-generational household, right? What can you do to protect your child? There might be someone, and some of you may have experienced this, someone may test positive in the home, right? What do you do? I'm gonna use my own personal experience. Some of you guys may hear that my voice is hoarse because I actually, I came down with COVID. So again, part of my job is I oversee one of our COVID clinics and I'm exposed. And I had a friend say, oh, I'm so sorry that you got COVID. And I said, oh my goodness, I'm so thankful that I was vaccinated and boosted because my symptoms are mild, right? I'm so thankful that I have this protection and my symptoms, again, were relatively mild. But I actually started to have symptoms when I was home. I was visiting my family for New Year's. I hadn't seen my mom and my sisters in a long time. And I said, oh, I don't feel great. I said, I need to go home. I said, Mommy, I have to go. And my mom was a mom, right? Trying to make me feel better. And she started to have symptoms. And I drove back up to Delaware. And my sisters actually put themselves in their bedroom. They stayed there and my mom had to stay in the living room. Why? Because she wanted to make sure that they were not going to get any symptoms. So it is possible, right, to still be able to isolate and protect yourself in a home, even if there's multiple people. Some people say, well, we have a small home. That's okay, right? So the rest of the family can get cozy, get to know each other. You guys all stay in one area, everyone stay in the living room, right? And the person that has symptoms, right, or has tested positive can stay in the bedroom. You can figure that out. Everyone in the house should then be wearing the mask, right? When you're walking around, you know, take out your Lysol wipes, use your hand sanitizers, you're touching different surfaces, wiping that down. And just making sure, again, that that person who's positive is staying away from the families as best they can. So I will tell you the best outcome is that, yes, my mom developed symptoms. My two other sisters who stayed in the room did not get any symptoms. They took a rapid test. They were negative. So we know that because they were isolating in the home, that also protected them. And all of them are vaccinated and boosted. So I think that also helped as well. So not only is that important to protect children, but we still want to protect the other family members in the household as well.
And if I may, I just want to add something about masks that I saw in the question. If you have a cloth mask, it's not necessary to throw them out and buy disposable masks. You do have to wash your mask every few days since you're using it. But you can always make sure that if it's not 3 layers, that you create another layer in that cloth mask. Some of them come with a pocket that you can insert a filter. And if you don't have a filter, you can use even a coffee filter, cut it to shape of your mask, and you put it in between the layers of your mask. One other person had commented about, are you rebreathing CO2 when you're having your mask on? No, CO2 is a gas that's able to go through the mask. You know, as surgeons, we wear those masks every day and we're not inhaling CO2 all day. So the mask is there to protect you against bigger particles and viruses that are not going through the mask. Gases can get through the mask. So I just wanted to add that there.
Thank you for that. Thank you. And we are coming towards the end. And so I do want to give an opportunity for each of you to give final thoughts and to, you know, just provide what you feel is the most important piece of information to those who are watching right now.
Well, I'm going to go first because I'm going to jump off. But one of the things I want to say that many people are still reluctant to get vaccinated, and you may have different reasons, but talk through those reasons with your health provider, somebody you trust to give you answers and honest answers. We want to be real, we want to be honest, and we want to understand your reluctance. So find someone that you can trust so that you can begin to get your answers, your questions answered, so that you can move forward with getting your booster and your vaccination as soon as possible.
Doctora Ángela, para culminar, le vamos a dar la oportunidad de hacer un pequeño resumen de lo que usted piensa que es importante que la comunidad hispana esté alerta. Por favor, denos algunas palabras de aliento y de llamado. El llamado a las personas, por favor, doctora.
Gracias, Wanda, para decirle a la comunidad que en esto estamos todos juntos, que es importante que cada uno ponga de su parte, uno a uno, niño, abuelita, tío, primo, entre todos. Uno que no se vacune, uno que nos entrega la enfermedad a todos. Por favor, discutan la vacuna. hay que tratar de entender que es por el beneficio de todos, que mientras que no nos vacunemos, este animal, como lo llamo yo, va a seguir cambiando y se puede seguir multiplicando y puede todavía crearnos muchos más problemas. Hemos tenido mucha mortalidad, mucha tristeza, mucha angustia. Por favor, ayúdenos a que combatamos este virus y los necesitamos es a cada uno de ustedes allá detrás que vaya y se refuerce y se vacune para poder terminar con esta pandemia que ha sido tan dolorosa para todas las comunidades. Entonces, la palabra mía para todos hoy, esta noche, recordar la vacunación.
Muchas gracias, doctora Ángela. Gracias por estar con nosotros. Sharonda.
Ori, gracias.
Thank you. And just if you see a poll, you should have seen a poll if you're watching a poll pop up. Make sure that you are taking your poll. We really do want your feedback. We want to gather as much data and information as possible. And so it's just a couple of questions. If you quickly answer those before you leave the webinar. And Dr. Rattay, if you could give your final thoughts.
Sure. Again, I just really want to thank you for hosting this and building on comments that my colleagues have stated here. It's so important that we do all we can to boost our immunity right now. The two areas where I'm most focused and most concerned are around boosters. When you look at our overflowing hospitals right now, 92% of people in our hospitals have not been boosted. So boosters really do provide great protection, but our many Delawareans have not gotten their booster. And so, it's about 30% of eligible Delawareans right now who have gotten their booster. So we've got to see those numbers go up. I'm also very concerned about our low vaccination rates among children. So I just want to re-echo the many great comments of Dr. Mpasi, how important it is to talk to your pediatrician, your family physician, if you've got concerns and questions, but it's really important to protect our children. Again, thank you. And I'll hand it back to you, Sharonda.
Thank you so much. And Dr. Mpasi, right over to you.
Great, thank you. So again, just a lot of great information that's presented. And I'm going to just go back to our video testimony. I really appreciated his comment when he said it's better to have it and not need it than to need it and not have it. And I really think that about the vaccine. So both Dr. Scantlebury and Dr. Rattay really emphasized the importance of vaccination. And we have to understand that a vaccine really provides that layer of protection. And to have that is not only a reassurance, but it's a assurance, right, that you are providing yourself the most maximal protection that you can for your health and wellness. And I think about this as driving in a car and putting on a seatbelt. And I know a couple people have heard me say this before, but when you get in a car every day, right, so this is now talking to our adults and our caregivers, is you get in a car, you make sure that your child's in the car seat properly, right? You get in the car, you put on your seatbelt. You are making sure that you're safe while driving. You drive every day and likely go many days without getting into an accident. However, every day you still go through that routine and make sure that you put on your seatbelt. I'm sure none of you would get on the road without a seatbelt because you know that that's going to offer you some type of protection. If in the event you get into an accident, that is going to minimize the injuries that you can have. So I want you to think about that in terms of the vaccine. As people have said, the vaccine is not 100% effective of not getting COVID, but it will absolutely decrease your likelihood of transmission and decrease the severity of symptoms. So you are not in the hospitals where other people are and are suffering and are sick and even worse. So I want you to really think about how this vaccine can provide you, your family, and your community this layer of protection to ensure that you are your healthiest and your best to move forward.
Thank you so much, Dr. Mpasi. And Dr. Coker, can you take us home?
I'll simply say this. I had a patient say to me during this pandemic that she really believed that this was a global initiative and really just a test. And right now we're failing, and we're failing because we can't do it without one another. So until you get out of your own way Because while you may be an herbalist and a naturalist and, oh my God, Joan, I don't put anything in my body, you don't understand. I do. I 100% do. And I believe that possibly if you got it, you'd probably survive. But at the end of the day, please understand it's not about you. It's about that munchkin that didn't make the cut yet because they're not yet 5. It's about that cancer survivor that got boosted, vaccinated, looking for another booster whenever it comes out, that may not have mounted the response. And all you wanted to do was give them a hug and say, I haven't seen you in months, and you accidentally took them out. So let's just be abundantly clear. This is a test. And it is about, am I my brother's keeper? And my response is, yes, I am. So while we're exhausted in healthcare and really almost at the end of the road, we're going to keep pushing and we're going to keep getting up, because no matter what, vaccinated or unvaccinated, we are at your beck and call. But if you could just help us, help you, we would really be in much better shape. So I want to thank United Way, and I want to thank my colleagues on the front line for joining me tonight. Thank you, Dr. Rattay, for all that you have provided for our state and your leadership. And this, Sharonda, Wanda, has been excellent. I've really enjoyed being a part of this. Thanks for the invite.
Oh, thank you. Thank each and every one of you, Dr. Coker, Dr. Scantlebury. Thank you, Dr. Mpasi, Dr. Rattay, and Dr. Angela. You guys have provided so much valuable information, and we really appreciate it. And thank you, everybody who watched, who asked questions. If you didn't get your questions answered, please, afterwards, you will see where you can call or send in questions. We want to make sure that you're getting all the information so that you can make the decisions that you feel are best for you and your family. Thank you.
Muchas gracias a todos por participar. Muchas gracias por los panelistas que se unieron a nosotros a este mensaje tan importante para la comunidad en Delaware. Gracias por estar con nosotros. Al final va a haber en la pantalla información donde usted puede enviar sus preguntas. Este mensaje ha sido grabado, así que vamos a mirar a las preguntas que ustedes hicieron. Muchísimas gracias. Que pasen buenas noches y gracias por estar.